Hi, this is Dr. Janowski for Sonata Aesthetics. Today we're going to talk about PRFM. PRFM is kind of the next level of PRP. So we've got PRP, which is platelet-rich plasma, and then the next kind of generation is called platelet-rich fibrin matrix. It's similar, but there are some advantages of PRFM over PRP. It's also drawn from your blood, it's spin down, and we have a little bit of sampling here of the plasma. The difference comes in when we inject calcium to create what's called a fibrin matrix. So the fibrin matrix starts to form right after injection of the product, and that matrix serves as a web or a network for growth factors to latch onto it. The theory being the growth factors will stay in the place where you want them to go, and they won't dissipate or drift from the area, so you'll get a more concentrated response. So we can see better results than with just regular PRP, but it's essentially the same process, and we can use it in the same way. We can use it as a regenerative serum, both topically for microneedling, or we can inject it. So we're going to show you some injection today of the PRFM, and then we'll follow Jeanette over time and see how she does. Okay, so now we have our plasma. It's been activated, so it will form that fibrin matrix after injection, and we're going to put it in the tear trough. This is a really great place for PRFM, just like it is for PRP, because we can get good skin regeneration and improvement. And so we'll use a cannula just like we would for a filler, and we'll place it in our usual location. And this is going to go in just like water, very, very quickly. It just goes in, and you'll see a little bit of swelling, which is really not so much swelling as just the fluid going in. And this is 1 cc, and we're just going to put it around under the skin, all over, and just get it in there in one quick treatment here. Okay, that's one side. We'll do the same thing on the other side. So we've just put some in the under eye. Now we're going to use some PRP in the nasolabial fold. Again, very similar to what we do with a filler. And you can get some filler-like effects as the new collagen grows in the area. But as far as putting it in, it's very, very simple. It's just a cannula injection. I wouldn't expect any bruising at all, just a little bit of the fullness from the fluid. That's one side. And I would expect this little fluid fill effect to last maybe 24 hours. I gave her a little bit of numbing beforehand, so I'm not feeling much of anything here. And we're just placing it up into the nasolabial fold here. And this will improve skin quality significantly. Now I'm going to do some in the cheek area so we can improve skin quality here and a little bit of volumization. And again, it's the same cannula concept here from the same entry point, so it makes it very easy to recover from. There really shouldn't be any kind of recovery here. Okay, that's one side, and we'll do a little bit on the other side. Okay, we just did the PRFM treatment with a product called Cell-Fill. Well, the product is really the patient's blood, but Cell-Fill is the process that's patented. And, right now we're just seeing a little bit of the volume from the fluid. That'll be gone, in about a day or so. And then, just like any collagen-stimulating process, we watch the patient over several weeks. Generally, the regimen is, for this type of treatment, is 3 treatments 6 weeks apart. And so we'll do a series of treatments to get more and more improvement, and we'll see some nice skin changes. I don't expect any recovery here. These little white dots are just from the anesthetic. So it was a pretty straightforward, that wasn't difficult. No, easy treatment, and a great skin regenerative process. So that's called Cell-Fill.